Well, victims of the Abundant Life Christian School shooting were sent to SSM Health, St. Mary's Hospital, and UW Health.
That's right. UW Hospital received 3 patients related to the shooting yesterday. And here to talk with us about how UW Health prepares for situations like this is Dr. Jeff Potoff. Good to see you.
Good to see you guys too.
Despite the circumstances,
yeah.
This is something as an emergency room, as an emergency department, if you will. This is something you prepare for. You work tirelessly for, mass trauma events.
Yeah, I mean, we have to be ready because we never know whether it's something as tragic as this, a school shooting, whether it's a big pileup on the interstate. There always exists that possibility that suddenly, within minutes, we're going to get inundated with a whole bunch of really sick patients. So we have policies in place, practices in place, and then, training that kind of keeps us sharp on this just because it doesn't happen every day. And thankfully, that stuff worked really well yesterday.
Yeah, it always amazes me because you have to act fast, you have to be precise, and you also have to think about the other patients around there. How do you do that, that combination?
Yeah, I think it really comes down to training, right? Like if you just took this de novo and said, hey, what do you want to do? We for sure would not get it right. But we talk about it before it ever happens, what we would do. We've got some, lived experience, and then you train on it. I think it really starts with those first responders, police, fire, EMS. They're our eyes and our ears. As much as they're taking care of people on the scene, they are thinking 3, 4, 5 steps ahead. They're letting us know what's going on. And then likewise, we kind of jump into action, both with a statewide system that allows us to know very quickly what the capacity of local hospitals are. And then we can also quickly ascertain, like, well, does UW Health need to divert maybe some lower acuity patients because we know we're going to get an influx of really sick patients. We can do that with our hospital partners very quickly. And then there's the space and the staffing. So we have to take action as far as like freeing up some of those rooms in the emergency department. Maybe that inconveniences some patients, but it's worth it. Pause those OR cases that are about to start and say, hey, we got to wait. We got to see how many ORs we need for these people. And then our process is to notify staff. You can imagine we're a 24/7 organization. That means a good number of our staff are not at work. We can instantly get a hold of them, get them ready to come in if they're needed, segregate them in an area until we need them. But all that together does allow us to really deliver amazing medical care to a large number of people in a moment's notice.
I always say we are truly blessed in this community with the healthcare providers that we do have. But as it occurred to me yesterday, as we were on the air, as these patients are being treated at both hospitals, there's also the rest of the world goes on. You're still dealing with all that stuff as well. It doesn't stop.
No, it doesn't stop. I think people do afford us a little bit of grace as far as like inconveniences that might happen to them, knowing that we are actually addressing something that's much bigger than any of us. But yeah, nothing ever really stops. But sometimes you just got to dig a little bit deeper, go that extra mile to know that you gave it everything you got for these folks that are really suffering.
Well, fully transparent, my father was an emergency room physician. I have tremendous respect for the work your community does, and I know it's a difficult time. I hope everybody gets a chance to pause and catch your breath, because I know it's difficult for healthcare providers as well.
Everyone's human, so yeah, we're all digesting it, and for anyone out there who is suffering, it's important to get help. These are tough things to work through.
Dr. Jeff Potoff, thank you so much, as always.
You bet.